Hi, my name is Mohit Dar. I'm a clinical associate professor at the Brody School of Medicine in the Division of Endocrinology and Metabolism. And my colleague Sami Beg, he's the CEO of Proactive Living. Both of us published this concept paper. Type 2 diabetes is a worldwide epidemic, and it's estimated that approximately 422 million people worldwide have type 2 diabetes, and in the US about 30 million Americans have type 2 diabetes. You have this epidemic of diabetes, and yet I felt like we didn't have a very effective way to communicate between providers and between provider and patients in terms of conveying the seriousness of the disease. I was impressed how the oncology community, how effective they've been in terms of categorizing how bad the disease is, what's the chance of survival, and then using that information to plan treatment. We came up with what we call the diabetes staging system, or the DSS, and this staging system essentially draws on literature that's already been published in the field, and it uses vascular risk as the basis of staging diabetes. And as you can see in the following table, we use a strategy that's similar to oncology, where we stage the diabetes, and then we also have a substage that's based on A1C and GFR. And what we hope is that with validation studies we'll be able to show that the higher the diabetes stage, the greater the likelihood of dying. And we also hope that we can use this as a communication tool between provider and patient, and provider and other providers throughout the world. And we also feel that this may help guide therapy. As you can see in this other table, when you stage the disease based on cardiovascular risk, there are emerging clinical trials that have shown certain agents like empagliflozin and liraglutide to improve cardiovascular mortality. And so we feel that staging can also guide therapy in terms of encouraging use of these agents to improve survival. And the other way we feel that it can guide therapy is to minimize risk. And so, as many of you know, patients will develop complications from diabetes, including chronic kidney disease. And as kidney disease progresses, certain agents for diabetes are contraindicated or should be adjusted in terms of their dose. And so, as you can see in the substage portion, as GFR progresses in terms of decreasing, there are certain agents that should be avoided. And so this is another way where the staging system that we've proposed could guide therapy. So we really hope that a staging system can come or be developed, such as what we've developed, that can become the language for diabetes. Thank you.